This fall, NANN is heading to Palm Springs, California. Set against the backdrop of desert skies, we're creating a space for neonatal nurses to take the stage, sharing knowledge, amplifying voices, and driving change. Join us from September 9th through 12th, 2025, to learn from experts, engage in powerful discussions, and take action to drive meaningful change in neonatal care. Head to nann.org/conference to register now and take advantage of best value pricing. Hello, and welcome to NANNcast. I'm Jill, your host. Advocacy, one of the most important yet often overlooked aspects of nursing. As NICU nurses and APRNs, we are at the bedside every day, providing life-saving care to our tiniest patients and their families. But how do the policies and decisions made beyond the NICU doors shape the care we provide? And more importantly, how can we as nurses play a role in influencing those policies? Many nurses feel uncertain about advocacy, what it means, why it matters, how to get involved. We might think, isn't my work at the bedside enough? Or how can I possibly make an impact on healthcare policy? To help tackle these questions head-on, I'm joined with NANN's past and current chair of the Health Policy and Advocacy Committee, Michele Sweet and Susie Taylor, who are deeply involved in health policy and advocacy for our patients, families, and each other. They'll help us break down key terms like advocacy, policy, and legislature, explain why nurses' voices are essential in shaping healthcare decisions, and share practical ways to get involved at both individual and organizational levels. Let's get right into it. Thank you, Susie and Michele, for joining us today. Advocacy is a key part in nursing, yet many nurses feel unprepared or really unsure of how to get involved beyond the bedside. But healthcare policy is very important, and it directly impacts our care every day. And it's crucial for us as NICU nurses and APRNs to have a voice in shaping decisions that are going to ultimately affect our patients and our families. To start, Susie, can you help us break down what advocacy means in the context of neonatal nursing?
Absolutely, and thanks for having us, Jill. Nursing is, first of all, advocacy in itself is just public support or a recommendation for or a specific issue. So NICU or NICU babies and their families. As NICU nurses, we are in a unique position to see the successes and failures of the healthcare system and really speak to that. As bedside nurses, we speak up for our patients every day in rounds. We speak up for our patients with social work and different things within the hospital, but as healthcare policy, we also need to get out there and share it with the legislators who don't know what we do every day. In nursing, we often are so busy doing the work of caring for our patients. We also get intimidated by the idea of talking about politics because politics are one of those do not talk about subjects, but really, definition of politics is an activity that's associated with making decisions for a group or a group of people. Talking about politics does not have to mean Democrat or Republican or one side versus another. It's just an act of actually having a conversation about policies. And as nurses, we talk about policies every day, from putting an NG tube in to putting your baby on a monitor or not for their bilirubin. Some of us put kids on O2 monitors when they're under Billy lights. Some people don't. So that is a policy that we're all familiar with. Talking about policy in healthcare and how decisions that are made at a government level impact us and our lives and the things that we do every day versus what it impacts our patients and their families. That's politics, but it doesn't have to mean you're right or wrong.
Susie, your definitions really brought it down to help understand that it's policy. We're used to dealing with policies like you said, but these are just policies beyond the bedside, beyond the NICU doors. So if you frame it that way, it's easier for us to be able to have our voice, just as we're patient advocates during rounds, but we can be patient advocates outside. Why do you think that there is this gap in learning about advocacy for nurses? We don't learn it in nursing school. I don't think that was a big part of it in my program. What do you think that is, and what can we do to change that?
Nursing school is so jam-packed, whether you are in a traditional four-year BSN program or an associate's degree program or in an accelerated program of any kind. So they don't have a lot of time to talk about healthcare policy and how to be involved. Their focus is on getting you to the ability to pass your NCLEX and graduate and care for patients at the bedside. And as a bedside nurse, one of the things that was really intimidating to me was the idea of talking about advocacy outside of a hospital. Like, I can talk to doctors and NNPs and advanced practice providers all day long, but I was never taught that in nursing school. And I always saw it as the role of our advanced practice nurses or providers, because the first class that I ever took when I was thinking about going to NNP school, didn't go to NNP school, was actually a healthcare policy class. And that's a class you learn at an advanced level. So yes, naturally that advanced kind of conversation about research and about diving into different topics is naturally taught to advanced practice providers. It's not at a nursing level because they're trying to teach you the foundation of nursing and how to advocate for your patient at a bedside, and how we as nurses, whether you are an advanced practice provider or you're a bedside nurse, we are good advocates. And it takes time and experience to learn how to use your voice and how to speak clearly and concisely and translate what you're doing every day and how things are being impacted. I think it's one of the most important things. A lot of times, especially as a newer nurse, you're still learning about how to be a nurse. You're learning about managing patho with your tasks. And so in nursing school, like, you're trying to memorize your lexicon as much as your ability to pass your NCLEX. You're not going to necessarily correlate that to, what's next at the bedside. So I think it is a problem that we don't focus on in nursing schools. I think we need more exposure and maybe some cross classes. We have a lot of business classes, I think, as a prerequisite for nursing for a lot of schools. Maybe there should be a policy class. Maybe there should be a more government focused class that nurses should take that isn't nursing focused, but does still teach them about the executive orders, or talks to them about like the process of government, because we all get that in elementary and middle school and high school. But let's be real, we kind of all forget about like what our high school government class taught us sometimes, when you're so focused on pharmacology and pathophysiology and making sure you're meeting your degree requirements.
Yeah, I agree. And I think that that's a last thing on our mind. Sometimes we're just trying to stay afloat and finish our shift. So that's the last thing we think of. But I think we have to change our focus and think it's not just like one person. It's not individualized. You can utilize other organizations to help inform you on things that are happening that can potentially impact your patients and families. So going on NANN and seeing their health policy and advocacy committee work, utilizing the March of Dimes, there's lots of organizations that can help introduce you to the things that are going on a legislative basis to keep you informed.
Yeah, I would totally agree too. I did not have any exposure to that in my bachelor's degree, but I was always politically motivated and aware. And so I kind of took that on myself to be involved, but it's not for everybody, right? Because I think it does seem like it's political and it's politics, and I think people get worried there. But the focus we want to have more is directly, how does this legislation impact our patient population, right? And how can we advocate? And I think you're right. I did not really learn more about doing that and diving in until I was getting my master's degree and took classes and heard about funding that, or maybe a bill that would get passed through, Congress, maybe make it through one house or stall and then have to go back the next year. That kind of surprised me. Or it would pass both the houses and never get funded. And I think in grad school is when I had a big aha moment about how cumbersome this process is, right? And how much I needed to learn, and how much they really did need to hear from nurses, because we have a really strong voice and we have stories, and we can be some of the best advocates for our patients and families.
I think nurses often feel that change is slow. Just even in your own unit, when you want to change a policy, how long does that take? How many meetings do you have to go through just to change one bedside standard practice change? How do you respond to nurses that feel that advocacy efforts take too long, or I'm just one person, I'm not going to be able to make a difference?
I think the idea that you're just one person is something people feel universally when they're talking about policy or government or legislation. So we're not alone in that. But I think the fact that what we do every day is so respected by members of the entire world. I mean, nursing has been the most trusted profession for like 22 years now. Like, people care what you say. They care how you respond to them. And when you're talking about healthcare and healthcare policy, even if you don't know what the policy is that you're specifically talking about, you're talking about your own experience. You're talking about what you do every day and how it impacts people. And, I think about specifically an example of when some of the HIPAA laws changed, where we now have like My Chart and Epic Bedside. So parents can see they can see test results in real time. And what did that do to us as bedside nurses? Like, wait, what? They can see this at 11 p.m. and they're going to call me and I'm going to have to speak to this? Like, as a nurse, am I allowed to do that? That was law. That was like a healthcare policy law. And like understanding where that law came from and why it came about is huge, and how it impacts me, which is huge, which is also a big thing. So it's not just like, great, someone has this idea and it takes a long time. And these people have worked for years to get it to the right spot to make sure it impacts you. But then as nurses, like, we need to be aware of it so that we can say, wait, I, as the nurse at night, am not, like, it's not within my scope of practice. It's not my ability to answer this parent's question at 11 p.m. But they still get the right to see it. But that's healthcare law and that's healthcare policy, and understanding that, like, we do need to be aware of it, and we need to be able to talk to the legislators or the people who are going to be voting for this, saying like, hey, this sounds like a great idea, but wait, there should be some parameters that protect us as providers, saying like, you can see it, but we can't necessarily explain all the details.
I think one of the biggest things too is giving yourself permission to get started. So I think for people who feel like it does take a really long time, I might counter and say, have you tried it? Because if you do sign on to, like you said, A1 or NANN or March of Dimes, there are great links and there are great podcasts out there that you can hit this link, put in your name and zip code, and the letter instantly appears to your senators in whatever state you're in. So you don't have to draft all your own letters. You can add some information in the bottom. But I do feel like, organizations like ours and those are working really hard to help get the word out. So that's a great way to get started. And then maybe your name pops up and a legislator sees you're a constituent in their area, and maybe they have a question about something specific in your community. That could be the start of a relationship. Or you could just write them a letter and say, hey, I'm Michele Sweet. I live over here and I have all this experience. I'd be happy to speak to you about the NICU if you just want to keep me as a resource. And you can introduce yourself. And you never know, you may get a phone call or you may get an email. And it starts really simple to build that relationship with them. But really, I always try to remind people, legislators have healthcare aides, right, who help and they have librarians who do literature searches, and they can pull all of the lit they need to on a hot topic medically, like when the HIV outbreak, right? They didn't know how it impacted the community. How do we get people back home? Same thing with COVID, right? Same thing with NAS and NOWS. Like, they can see what is happening in the literature. Oh, we have to treat these babies with morphine. But what does that mean? How does it impact the family? How do we place these children, right? How long are they staying in our NICUs? Those are the stories behind it that these legislators really need to hear. And that's advocacy, storytelling, and I have done a lot of that locally. And I had a fabulous relationship with one of our senators who isn't in office anymore. And I would share a lot of that, and I think that was the best part of it. I loved sharing. So if you like to story tell, you would be surprised. It's easier than you think.
I love that because Susie said, we have limited representation in legislation, but they need to hear our voices. They need to hear our lived stories. And when you put a story and a face and a feeling and emotion to something, that can really bring to light, what are we voting for, or what are we trying to get passed? What policy changes are we trying to make? So that's why it's really crucial that we do step up, even though we think it's just one person, but it's not just one. Like, the power that you have can really, like, through storytelling, just tell a story. Just like you said, all of that is important for us to be able to share our experience and be able to make those connections with the legislators out there to see, what are we really working towards? What is our goal? And it's healthy families and healthy babies.
Well, and Jill, one of the things you said is like, you're just one person, but for me, that's also why you lean into your associations. I think whether it be NANN, which is NICU specific, or AWON, or there's over 4 million nurses in the country, and we are all advocating for our patients and their families and each other. And not just nurses, we're people. We're all have families and lives beyond our bedside. So I think, there actually is a larger voice. And so I think that's been a huge push for me personally, getting involved in NANN and being on the Healthcare Policy and Advocacy Committee, being a part of the board, is the volunteer aspect of connecting with other people around the country and really realizing I'm one person, you're two other people, but we all work with hundreds of other people and have that impact in that conversation. So I think really leaning into that world and realizing that together our voices are a little bit stronger is great and awesome, and a great way to, share those stories and continue that conversation about healthcare policy.
I think it's also important to note, and this might be a good time to talk about it, there's a nursing caucus, right? Every year, there are co-chairs and chairs appointed, and their whole goal or mission is to advance nursing policy, right? To support nurses. And so, like, this year, there is a senator whose wife is a nurse, who's a chair. There is a senator from Oregon who is very healthcare driven and motivated. And then there are two co-chairs, Lauren Underwood, and is it Gideon from the other senator, who is a nurse, and they're nurses, right, as co-chairs and congresswomen who represent us. And so your one voice to them is very impactful because they work, as Susie said earlier, across the hill. It's totally bipartisan and involves everyone. And so speaking up could feed this caucus who does want to sign on for legislature to support nursing with a lot of the ammo that they need, right, to move things forward. So I think, I'm not sure if everybody knows that that's out there. I think that that's probably something I learned when I was getting my master's degree as well, that there was a whole voice out there for us, representing us.
For those that are interested, how would they get connected to this group?
To the nursing caucus, you can actually Google it, or you can go to congress.gov and put in nursing caucus, and it'll come up with the committee. Their mission is listed, the names of the chairs and co-chairs are listed, and this is something that they have to sign on to every year. So when I got to walk the Hill and go and speak to some of Congress, I was able to ask some to sign on to the nursing caucus, and they were like, "Oh, we're already on it." And I'm like, "Well, you were last year, but your name isn't on there yet this year." So it was a really good reminder to touch base with them as well. So if you don't see your legislators on there, reach out to them.
We talked about how we have to get over the feeling that we're just one person. And now we know that there are lots of resources out there for nurses to begin their journey in advocacy. But what are some other barriers that nurses may face when they're trying to take on this new role?
I think there's a couple barriers. I think a lot of them are both self-imposed and then a little bit like systemically imposed. So one, do I have the expertise to talk? I think we've all heard of imposter syndrome. And, do I have the expertise to talk about it? Absolutely. You are a nurse. We know what we want for our patients and how to advocate for them. We know how to use our voice in that way. So as a nurse, you are an expert. I think it's also a barrier of, we are in some ways, especially when you are a bedside nurse, a BSN trained nurse or an ADN, you aren't the one giving orders typically. We might advise people on what we would like as orders and make recommendations. But that's the exact same thing as you're making a recommendation for a policy change, or you're making a recommendation for how a policy should be implemented. So I think it's that feeling of like, my recommendation, just like you would in an S-bar, can be utilized just like everywhere else. So I think that, using that S-bar and feeling that like recommendation piece is important. I also think we just want to do the work. We're ready to like care for the patients and, do what we need to do. But like the background is important. I think the other piece that I'm seeing in NANN is also people are a little bit intimidated by their employer. Like, if I speak out, am I going to get in trouble? Well, that's where you really have to look at, like, there's 3 different ways to approach healthcare advocacy. And one of them is you are speaking as an individual. So, social media is everywhere. You might have a LinkedIn account that says where you work. Well, if you post something about a law, just say, this is my opinion. This is what I'm saying. This is not the opinion of where I work or that I'm a member of NANN. As a person, or when I'm writing to a legislator on a topic that's not healthcare related, I might say, like, I am your constituent. I live in your region. I'm advocating for myself as a person or my family. And then, go on. So NANN promotes, something that March of Dimes puts out, like, you sign a letter. Like, I'm advocating on behalf of NANN as a member of NANN. And that's something that we are approving for our members. And then there's that fear of, like, my organization's going to go against me and they're going to be upset. And it was actually that's something that when I was in my master's program, saw firsthand. I worked with a legislator that was a nurse, and he was proposing a bill that had staffing ratios in it. And his organization came and was like, what are you doing? Like, you shouldn't do this. And he's like, you can't tell me what to do because I'm advocating as a legislator and I have this mandate from people saying this is something they want. And it was really cool. Was it super intimidating? Absolutely. But I think you still have that right, whether your organization is going to support you or not. Like, if you're speaking as a person, you do have that right to speak up as you want. But that is a barrier, I think, for nursing to kind of push back a little bit. We definitely do it in the hospital when we have a very finite moment. We have those crucial conversations, but it's the same outside the hospital as well.
Yeah, I think we do a really good job advocating for our patients at the bedside. And we just need to take some of that passion and energy and, flip it and look from the other standpoint, especially with the proposed cuts to Medicaid, right? That is going to potentially have a huge impact on our patients who are not going to do very well with the cap, right? And block grant funding, excuse me. So it is very intimidating. And I have to say, I often would be like, what did they say? And I'd be Googling terminology, right? Like there's absolutely nothing wrong with that. There is no way we know all of their terms. It's kind of like when they, first came to the hospital and said, we're going to put in this information healthcare system and it's all going to be electronic. And they're talking about beta and all this other stuff. And we're like, speak English to us, right? I mean, our patients say the same thing, like, can you break that down a little bit more, right? So this is a whole other, you have to be, comfortable being uncomfortable, right? And it's okay, but take a leap. It's like taking a leap of faith and really, again, just transpiring it from, your passion at the bedside to, sharing that passion with the legislators. Like, look, our preemies can't take the hit. They're just not going to fall under that category. Like that might look nice on paper, but here's what that actually means in the end when we cut their dollars in funding.
And that's where our voice is so necessary to be heard.
Absolutely.
To bring all of this together, can you give us a real world example about policy decisions and how they impacted neonatal care at the bedside?
Yeah, absolutely. Going back about a year and a half, probably 2 years ago now, tariffs are a hot word right now, but they've been around for a while in different ways. There was a tariff coming on all enteral syringes. So thinking about those syringes that we use for feeding our babies, they were going to charge like 25%, I think a 25% tariff on those. And that would have been really challenging for hospitals to absorb. I think we all use them when we're gavage feeding our patients, and it was going to really increase the cost for hospitals across the country. And so nursing organizations across the country worked together to draft a letter and just advocate for that the government to exclude the tariff on those type of syringes. So whether that just impacted neonates or all of patients who might have enteral feedings, whether you be a baby or an adult, we signed on to a letter, and that ultimately was ruled out as far as like this is a needed medical equipment. So those were not included in the tariff on those syringes.
Yeah, and some of the specific things that they asked is like, why would it be such a big deal? And we said, well, if hospitals can't afford them or we can't get enough of them into the institution, people might try to reuse them, right? And think about the infection rates, right? And everything that could happen if we were doing like a saline rinse and going back to some really old practices. And so it was, by sharing, and actually, believe it or not, that was just like in the last 6 months we did this, like that we drafted that letter and voted on that. But it does seem like it was a while ago, but we can't, you can't go back to those practices, and they don't understand that, right? It looks good on paper, but that could have a very detrimental impact. And so again, that was the story behind the facts of associations like ours getting involved.
How can nurses stay informed about policy changes that may affect their care? So how would they know that there is this possible tariff on syringes? And where would they go to be informed on that so they can have their voices heard?
I think there's a lot of places you can go. I think it's important to look within the association of itself. So the NANN, we have an advocacy My NANN community, so there's definitely places you could ask questions there. Sometimes different information gets pushed out onto the general My NANN community. We have From the Hill to the NICU, which is our, how do we explain what the Hill to the NICU is to people who don't know what it is? Give a one-liner about the Hill to the NICU.
Well, From the Hill to the NICU is an abstract on hot topics, right, that are impacting our world. So we might write on the nursing workforce or proposals in cutting Medicaid. We talked about neonatal products and how specific they are. And we did talk about these tariffs that we just addressed, that they wanted to impact on the feeding tubes, that the U.S. doesn't produce most of the products out there that we use, right? The majority are imported. And so From the Hill can provide facts and information on that. And then within the NANN website, there's an advocacy, and it has the advocacy agenda items on there. And there are postings on there as well on issues that we're working towards. So you can definitely see it that route as well.
I also recommend joining the March of Dimes. I think they do a phenomenal job of pushing out information, and a lot of it's going to speak to you locally. I think one of the things that people often get really focused on is national issues, because that's most often what is covered on social media or what we see in the national news. But really, some of the most impactful legislation that's going to impact each of us in our individual hospitals and organizations is at a local level. So, I live in Colorado, and so when you sign up for the March of Dimes, they ask for where you live, and they'll send me notifications about, hey, there's a hospital closing on the Western Slope, and that's going to limit maternity care in your area. Maybe you should reach out and talk about that. Now, I live in the Denver metro area and have access to a bazillion hospitals. There's so many hospitals in the area. But for people who live in the mountains or who live in more of a rural area, that's pretty big. And then also being a level 4 facility, that those babies, if they don't get maternity care, potentially could be transferred to my unit, and it could take days or hours for them to get here. That's going to impact me. That's going to impact the patients and their families. So I like that. I like knowing that the March of Dimes will push that out to me a little bit on a local level. I can see a little more information. Also, your local chapters of whether it be your home state nursing association or your local nursing association, they push things out as well. If you just Google healthcare policy podcasts, I feel like I've done that, and I found some that I intermittently heard about. There's one that's local, for this put on by pediatricians, and you can get information from there. So I think if you're seeking the information, there's plenty of places to find it.
Yeah, we also, at the NANN conference every year, there's usually a poster or a presentation on healthcare and legislation and advocacy. You can look at the ANA, the AACN. Even when you're certifying, I think they have different options that you can look at to include in certification for something different as well. So there really are a lot of routes out there for you to be able to look it up. But you do have to do some searching to get connected, to get started. So it's taking that leap.
And I also would encourage people, if this is something that they're passionate about or they have questions about, if your organization, it may not be your individual hospital, but most hospitals are somewhat affiliated with an organization if they're smaller, they probably have a government affairs team, because things that happen at legislation affect everybody, even on a micro level. So thinking about, transparent billing process. That was a law that was passed that impacts the hospital and our billing. And great. It's a great tool for families to be able to know what they're paying for. But someone in our hospital had to figure that out and how they're going to implement it. So if you reach out to your government affairs team within your organization, oftentimes they have really great resources, or they might even have a site on your own website. So look within your own organizations as well.
Yeah, I was just going to say that we definitely have representatives who bring back topics and will post things and also speak at our neonatal retreat days or come to us if they know something big is coming.
Speaking of something big, executive orders has been a hot conversation topic across the country. But I think we need to take the political aspect out of the executive orders and reframe the discussion around the impact on healthcare and patient outcomes. So it's not political, but it's more of how are these executive orders going to impact our patients and our families that we care for every day. We know executive orders can have a significant impact on healthcare policy and sometimes having very quick regulation changes. Can you explain what executive orders are and how they can influence neonatal care?
Sure, I'd be happy to talk about executive orders. Executive orders are a policy or an agenda item that the current president wants to sign on and execute to maybe implement a new policy or rescind a previous policy that was in play. So one example of executive orders that hit healthcare have been involving some of the COVID grant funding that is out there, which impacts, our hospitals, which are still seeing patients admitted and hospitalized with COVID, pregnant mothers, and it impacting our neonatal population. Medication drug pricing is something that has been rescinded from the previous administration. Immigration laws and policies, hospitals are considered sensitive areas, and it's not an area where immigration laws can really be implemented. But that legislation is an example of something that was rescinded. And so even though it may feel like it's political, it impacts healthcare overall, right? And one of the more recent ones that hit everyone in the field of science was to freeze the funding of grants with the NIH, right? And it proposed, and I guess kind of put people into a little bit of a frenzy and chaos on the immediate stop of payment to grants in process. And we all know that we have a lot of grants and research within our world that we heavily rely on, right, to further care at the bedside. So I think when people see some of these things happening, like executive orders, they don't necessarily understand, like, oh, that doesn't impact me, or how does that impact me? But it really does. And you can easily, again, search this executive orders in healthcare, and you can see a whole list kind of populate and generate that are touching healthcare and that are kind of in the works for being implemented. I don't know. Susie, do you have anything to...
I think it's important when you talk about executive orders that this isn't a new thing. I think there have been a lot of them really quickly in the last couple of months, but executive orders have always been used by presidents throughout the history of our country. And they're trying to move through whatever the red tape is of government. We always say, we've been talking about that a barrier to nurses being involved in healthcare is it's slow. Well, government is slow. Like, it is a thing. So executive orders are sometimes used to cut through some of that red tape. There is a checks and balances system in our country, and that is where the judicial review comes in. So we've seen in some areas where, like, oh, they're saying that's actually not legal. Well, yeah, that's their job. Like, so they might say that, that freeze is not legal, or this order, the way it's written, is not legal. And that's the job of the courts. Like, that is what they're there for. Whether they can argue it and the executive order can stand, great. Maybe sometimes they stand and they continue. Sometimes the president pauses NIH funding, and then you might slowly see some of it coming back because they realize it's important. Or actually, we are going to freeze it. We're going to send it down to the committee, and they're going to decide. So there's a lot of different variations of what an executive order can do. It's a faster way to get a policy change made. And I think it is like a lot faster than a bill that becomes a law that goes to Congress and has to go from the House of Representatives to, if you're a law, there's we can all remember how a bill becomes a law and the Schoolhouse Rock video. If you've never seen it, please go see it. It's actually very excellent, and I really love it as an adult. I didn't love it when I was in 5th grade, but I like it now. But it is really helpful and talks about how a bill becomes a law. And an executive order just kind of skips that a little bit. That funding for whatever the executive order is, that funding actually still has to come from Congress. So it's not perfect. So if, the president decides to write an executive order establishing something new, the funding still has to come from Congress. and Congress holds the purse strings. So, this last week they voted on a budget. And I think recognizing that the budget impacts, so we're talking about there's potential cuts to Medicaid. Congress passed a budget. Now, it's a temporary budget, but it is what's going to fund our spending. And so when we ask people to pay attention to potential Medicaid cuts, that budget said this is the cap on Medicaid. It didn't say how it's going to be distributed. It didn't say okay, people of this income aren't going to get it. It was still very vague. So when you think about how you as a person can be involved, figure out what that potential cut could mean to your state, what it could mean to your hospital, what it could mean to you personally in case you are someone who has a child on Medicaid or it serves people in your community, and start asking those questions. Send an email to your representative or your senator and say, hey, explain to me this, or I think we need this funding for, moms and babies. Medicaid supports 41% of births in America. And I want to make sure that whatever this cut is, that those moms and babies are still going to be served for when they're delivering their babies so that we have healthy children. It's things like that executive orders can impact, but we also need to realize, just because an executive order is out there, there are other ways to fund it, or also, put a pause. And that's what you're seeing when people talk about the judges and justice review and pauses on different things that the current administration or previous administrations are putting in place. Kind of going back to those tariffs, that was a tariff was part of an executive order, I believe. Michele, correct me if I'm wrong, that tariff might have been. I could be speaking out of turn here. And people protested against it, and they asked questions, and they said, why should we not include this? And change was happening.
Yeah, and I think it's a really good point that you bring up. Every president exercises the right to rescind or to initiate executive orders. So there is nothing new. I think just the only difference with this year is just how quickly they came in a shorter time period. And I think that realizing how it's impacting healthcare and our patients is the absolute key here for it instead. But you're absolutely right. It is not new.
If you could give one piece of advice to a NICU nurse or APRN about getting involved in advocacy, what would it be?
I mean, I can start first and be quick, and then I will punt it to Susie. But I think one of the biggest things is remembering and feeling empowered. From what Susie said earlier, we are the most trusted profession out there, and there are 4 million of us, and just feeling empowered to use your voice is super, super important here. And hopefully we've shared with you how important storytelling is as well. And so just using your voice and getting out there and taking that leap is how I would leave it.
I think my biggest piece of advice is don't be afraid to ask questions. We ask questions every day as nurses, whether we're clarifying an order or we are asking a parent about their life and how we can help them. You're going to do the same thing with advocacy. Find someone, even if it's a shot in the dark. You can go on to NANN and try and connect with the Healthcare Policy and Advocacy Committee and ask questions. If there's something you don't understand, feel free to ask questions. And I think asking those questions and then being prepared to listen is really important, because we all come from different backgrounds. We all come from different areas of the country and have different experiences, and realizing that the same law can impact us differently is really important. And we just have to continue this conversation. I think people get so scared about talking about politics and policy and advocacy, but if you're just willing to even just start by asking a question, we can really make a lot of strides that way by having the conversation.
Thank you, Susie and Michele, for empowering us to be aware and engage us in how we can be more active in advocacy and policy and legislative efforts. So thank you. Make sure you never miss an episode of NANNcast by subscribing now. This podcast is made possible by listeners like you. Thanks for your support and letting us into your ears. Have a great day.